The Delta variant of the coronavirus is driving waves of new infections in countries around the world. It was first detected in India, but it's also spreading rapidly across the UK. Our Roxana Saberi reports on the push to get more adults inoculated and the bitter race between vaccines and the variant.
Outside this English soccer stadium, young people are lining up to roll up their sleeves.
It's the first opportunity I've had to actually get vaccinated, and I'm looking forward to it.
The UK is racing to vaccinate all adults, as the Delta variant has driven new COVID cases to more than 20,000 in a day, the highest figure since February. That's even though nearly 62% have been fully vaccinated, slightly more than in the US. But in countries like Russia and Indonesia, where vaccination rates are much lower, the new strain is blamed for overwhelming hospitals and filling cemeteries. And in Australia, where tough border controls had helped keep cases in check, a 2-week lockdown has now shut down Sydney.
It will become a very dominant variant globally.
Sharon Peacock leads the UK's efforts to map mutations of the virus. Can we beat this virus? It keeps mutating.
It's here for good, so people will become infected, but we know how to treat people, we know how to prevent infection, and we then learn to live with it.
The English city of Bolton shows one way how. In early May, with less than a third of adults fully vaccinated, a rate similar to some U.S. counties, Delta sent infections soaring. But after door-to-door testing and moving vaccination sites into more deprived communities, COVID cases have dropped almost in half, says vaccine director Dr. Helen Wall.
For people who are managing vaccine programs, it's about understanding why people are hesitant. Because hesitancy isn't just about, not wanting it. It's about not being able to access it.
Dr. Wall also told us while some vaccinated people, are still getting infected, few are getting hospitalized or dying. Anne-Marie?
So, Roxana, tell us more about the city of Bolton, and can its success be replicated on a nationwide level?
Well, Dr. Wall, who heads the vaccination program in the city of Bolton, told us that it can, and it can also be replicated by other countries. She said what communities really need to do is to understand where the needs are in those communities, who's not getting vaccinated and why, and to talk to community leaders. And she says that's what they did, and they found that a lot of people were hesitant to get vaccines, not because they were afraid of what might happen if they were vaccinated, but because they didn't know how or they didn't have time to get vaccinated. So what the city of Bolton did was to send vaccination buses into communities of more deprived communities, as well as a lot of younger people who had not yet gotten vaccinated, so people could come whenever they had time to get vaccinated and speak to health officials. So she said it was a lot about communication, messaging, stepping up vaccinations, and also testing. They did a lot of, and they are still doing a lot of testing of COVID-19 from door to door by volunteers and the Army. So she says Bolton has learned a lot of lessons, and she hopes that other cities can do the same.
Well, Prime Minister Boris Johnson had to postpone his planned big reopening because of the Delta variant. How are things going? Is the government on track to meet its new target date, which is July 21st, or could we see yet, another delay?
Yeah, well, officials, including Prime Minister Boris Johnson, say that we are on track to what they've called Freedom Day, which a lot of people here are looking forward to that day where we're supposed to be removing all the remaining restrictions, which, you wonder if that is going to happen because it's only 3 weeks away, and it has been delayed already by about a month because of this Delta variant. But Johnson has said that it's very likely that England will pretty much return to life before COVID on July 19th. He said the country is taking a cautious but irreversible approach to lifting restrictions, and the new health minister here, Sajid Javid, said July 19th will be a date that life will go back to normal, and he said as soon as possible. But officials are looking closely at infections and new variants, and they want to also keep an eye on hospitalizations and deaths, and those numbers have remained low, relatively low, especially compared to previous waves of COVID-19 that have hit the UK. But I think they'll be keeping a close eye on that and then adapting as things go. But there's a lot of pressure from people in the public for things to get more back to normal. This country's been through a few very tough lockdowns lockdowns, especially during our cold and wet and dark winter. And I think a lot of people are in the mood for things to open back up, but they don't want to get hit by another wave of COVID-19. So it's really hard balance to strike. Anne-Marie?
Yeah, certainly understandable. Part of kind of what we do here in the U.S. is look to see what is happening in the UK in terms of the variants to get an idea of which variant will probably eventually making its way here to the U.S. What are doctors or epidemiologists telling you about why highly transmissible variants keep appearing in the UK?
Well, Dr. Sharon Peacock, who heads this consortium called COG UK, which is this network of researchers and scientists that gather data on the virus and sequence its genetic code and then share that code with the world, says that it's because the UK is so good at tracking mutations of the virus that this country seems to get hit by new variants all the time. The country, England, has sequenced about 10% of all positive COVID samples, which is greater than many countries in the world. The U.S., by comparison, has sequenced about 2%. And the UK then shares all of that information with other countries. And she says that's why it seems like we're always the place where new variants emerge, but it's just because scientists here, she says, are on the lookout for these variants. But there's also been a lot of criticism, Anne-Marie, of the government for not, for example, blocking travel from other countries where there have been hotspots of COVID and new variants sooner. For example, travelers from India were still able to come in for some weeks after the India variant was detected, the Delta variant. And so the government has faced criticism for that, but this is an international city, an international country, and as I mentioned, people are pushing for more freedom. So yeah, there's a lot of pressure for the government to keep opening up, and that might, be a reason that we keep getting hit by these new variants. Anne-Marie?
Yeah, there's a big debate about, whether travel bans are useful at all. What we've certainly seen here in the U.S. is that, the coronavirus might have been here long before anyone had detected it, and certainly before any travel ban was instituted. So who knows, what sort of a difference the travel ban that was in place here, which sort of difference it even made. Roxana, thank you so much.
You bet.